There's not enough protective gear to go around. Countries are scrambling to get hold of supplies, especially face masks, and as soon as possible. But some governments are being accused of using unscrupulous tactics and paying inflated prices to get their share. Berlin is accusing the US of carrying out modern piracy at Bangkok's airport and diverting a shipment of masks destined for Germany for itself. The heads of 3 regions in some of the worst hit coronavirus areas in France have accused the United States of effectively hijacking millions of masks at Shanghai airport. They were made in China and destined for France. Then it's alleged the US paid 3 to 4 times the going rate to obtain them. The US denies the allegations, but its need is great. Of the more than 1 million people diagnosed with the virus globally, the US has the highest number of infections.
These policemen in the city of Peshawar are lucky to have protective clothing. As Pakistani health workers demand government help, police and security forces are having to focus less on fighting crime and more on stopping the spread of COVID-19. The streets of Peshawar in the northwest of Pakistan are virtually empty. Police use loud hailers to urge people to stay at home. Government spending on healthcare for Pakistan's 225 million people has been less than 1% of GDP in recent decades. Hospitals are often significantly ill-equipped and overcrowded at the best of times. As COVID-19 spreads, desperate attempts are being made to prepare health facilities to cope with the rising number of infected people.
And on this Friday night, we have just heard from President Trump with new guidance on wearing masks outside the home. The president saying in light of new studies, the CDC is announcing the use of a non-medical cloth face covering as an additional voluntary measure. Voluntary was a word the president repeatedly used with regard to masks. They do not want a run on medical masks in this country. The number of deaths surging in the U.S. In New York State alone, 562 deaths in just the last 24 hours, the majority in New York City. Tonight here, the staggering numbers. In just 2 weeks' time, we've gone from 19,000 cases to tonight, more than 270,000. More than 6,800 are dead. And take a look at this graph tonight, showing the number of cases over time and the trajectory. We have talked so much here about trying to flatten the curve. The United States there in red, shooting straight up, well above Italy, China, France, no sign of it leveling off.
Announcing the grim record, the public health chief said that France still had yet to reach the peak of its coronavirus outbreak. The number of people to have died in hospitals has risen to a new daily high of 588. The total death toll is more than 6,500, a substantial increase from a day earlier because deaths in care homes are now being included. In a glimmer of hope, the health chief reported the lowest increase in people hospitalized with coronavirus in over a week, though he warned that it was too early to say it was good news. He also echoed the Interior Minister in reminding citizens to stay at home. Christophe Castaner warned that 160,000 police officers had been deployed to continue to enforce lockdown rules.
The South African Medical Association is accusing the Limpopo Health Department of risking the lives of 2 doctors. Now, both doctors tested positive for COVID-19, and it's alleged they were forced into quarantine at a multi-drug resistant TB hospital. The 2 had been in self-isolation. Sama says the approach could have unintended consequences.
We had a case last night with the MEC, where the MEC of Limpopo clearly stated to 2 doctors, and you can go on the SAMA website and you will see this whole drama that unfolded yesterday with these 2 doctors. She made it clear that they will not be treated differently from any of the patients. They are just the same, and which we accept. But then subpoena them with a court order to be going into forced quarantine after the guidelines is clear.
In order to contain the coronavirus, South Korea's nationwide social distancing drive has been extended for 2 more weeks. Following the decision, churches and other facilities where the risk of mass infection is high will be restricted for a longer period of time as well.
South Korea will be at a halt for another 2 weeks. At a briefing on Saturday, health authorities said that the nationwide social distancing drive will be extended for 2 more weeks to April 19th, originally scheduled to end this Sunday. The decision comes as the number of imported cases continues to rise and those with untraceable sources of contagion still occurring. Health authorities said, however, due to citizens' active participation, the number of cases with no clear infection process decreased from some 20% to 6% of all cases last month.
Well, COVID-19 cases are also rising sharply in Turkey. The country currently has more than 18,000 confirmed cases and 356 deaths associated with the virus. President Recep Tayyip Erdogan is under growing pressure to impose a general lockdown to slow the outbreak. What he did announce and introduce early on is a curfew for the chronically ill and those older than 65, people who have their own special needs.
Home delivery, Turkish style. For many Istanbul residents, this is not a novel way of doing their shopping. But with the coronavirus epidemic worsening, it's now become a lifeline for the city's elderly.
Still recovering from coronavirus, Prince Charles has opened an enormous makeshift hospital in London that will treat up to 4,000 patients. It came on another deadly day in the United Kingdom, with 2 young nurses among a record number of people dying.
9 days ago, this was little more than an idea. Now it's the largest critical care centre in the world. 80 wards and 4,000 beds waiting for a tsunami of patients.
In this dark time, this place will be a shining light.
Prince Charles opening the Nightingale Hospital via video.
I was one of the lucky ones to have COVID-19 relatively mildly, but for some, it will be a much harder journey.
Medical unions in Spain say the extent of the coronavirus in the country could have been avoided. They say the government ignored warnings from doctors working on the ground.
In this moment of the crisis, we realise how much crucial time we wasted at the beginning of the crisis. We had the example of China, which probably seemed too far away for us at the time, but it was actually a very close example of a society that has a lot of similarities with our society. An example which could have given us enough time to equip ourselves and to start the fight against coronavirus under good conditions.
After the first recorded case in January, the government said there was little cause for concern. But now the number of deaths in Spain has not only surpassed those of China, it's more than tripled China's total number of deaths. Spain has announced its 100,000th case of COVID-19. Some medical unions have filed lawsuits in at least 10 of the country's 17 regions. They are demanding that authorities provide them with equipment within 24 hours in line with health and safety law.
Dr. Haider Hantoush says he's watched wounded soldiers and civilians flood into Iraq's emergency wards over the past 2 decades of conflict. But he's never been so worried as he is now. It's an uphill task in a country like Iraq. Anti-government protests have brought thousands of people onto the streets since October. Despite the coronavirus threat, many have continued the rallies. They say corruption is worse than the coronavirus. Meanwhile, Shias, who represent a majority of Iraqis, have continued to congregate around shrines of saints, and thousands turned out for a recent pilgrimage. Many have returned to visit relatives to spread the blessings.